because of the progress we've made, because of your resilience and the tools that we have been provided by this Congress, tonight I can say we're moving forward safely back to more normal routines. I know some are talking about living with COVID-19, but tonight I say that we never will just accept living with COVID-19. We'll continue to combat the virus as we do other diseases.
That was President Joe Biden last night in a House chamber that told part of the story. It looked remarkably similar to pre-COVID State of the Union addresses. His cabinet, members of Congress, Supreme Court justices, by and large, maskless indoors. The president announced a new phase of his pandemic strategy that his COVID team further detailed today. It's a roadmap from a time of crisis into what we've been talking about for years, a new normal. It's a plan for keeping schools open, re-inhabiting downtowns, first through prevention, building on and updating those vaccines through boosters and testing. Preparedness is a big part of it to stay ahead of new variants, and through treatment with the new Test to Treat initiative that will soon offer a free test and then a free set of antivirals, treatment pills, in one visit at pharmacies and health centers all across the country. Joining us now to talk about it, one of the architects of these policies, the White House Coronavirus Response Coordinator, Jeff Zients. It's very nice to talk to you, sir. I had this sense that this, obviously the moment in history is what's happening in Ukraine, and President Biden is steeped in that. But the big turn for the country was what the president articulated, this turn back to a new normal. And I wonder if you can just flesh out the vision for that and what lays ahead.
Well, I think the president did capture it quite well last night in the State of the Union, Nicole, when he said we are entering a new moment in our fight against COVID-19, where we can move safely and begin to return to our more normal routines. We can do this because we have the tools to protect the American people. 215 million Americans are fully vaccinated. 2 out of 3 eligible adults are now boosted. As you said, we have very effective treatments. We're starting a new initiative which enables people to get tested at a location, a one-stop, where they can also get treated if they test positively for COVID and get treated with very effective antiviral pills that are 90% effective at preventing hospitalization. We'll have hundreds of these locations at local pharmacy clinics, community health clinics, veteran health centers, long-term care centers across the country. So the Test and Treat initiative is a very important step forward in protecting people against COVID. We have free tests, we have free masks, so we have all the tools we need to protect people against COVID-19.
Jeff, I have about 30 questions for you. I'll start with one follow-up. How much of what you all talk about is dealing with the psychology of COVID, of the anxiety, which polls show is mostly in the vaccinated population, to take off your mask, to feel safe, to trust that you've got 3 vaccines if you're vaxxed and boosted. Your kids, if they're older than 5, can be vaccinated if you make those choices. And how much of it is continuing to push on the science, or is it always going to be both?
Well, so first of all, I'd start by saying we're all tired and fatigued. It's been a long couple of years, and this virus has proven to be unpredictable. As I said, we do have all the tools at our disposal to fight the virus and to stay safe and protect ourselves. But at the same time, it's understandable that, people are tired and wary. And, I think this is an important moment to move forward safely, to begin to return to our more normal routines. But I think there will be situations where people decide that they want to mask. That's an individual decision. We'll continue to make vaccines available to everybody and deploy all these tools while we're always on watch to be prepared for any potential new variant. So it's an important moment, but we're going to continue to stay vigilant and support people through this process.
Jeff, I can hear the protests out there. I worked in that building. I know that it can be busy. I don't know if you know what that particular protest is about or care to say anything about it. But I do want to separately ask you about the campaign to encourage people to vaccinate kids 5 to 11. There's been some reporting in the New York Times this week about the efficacy of preventing infection, studies done during the Omicron wave. And I wonder if the effort to encourage parents to vaccinate, I gladly, enthusiastically vaccinated my 10-year-old, but I wonder if that campaign is altered at all, at least on the information side, by some of that new reporting.
So, here's where we look to our doctors, our public health experts, the FDA, the CDC, and follow the science. And all the science says that vaccination is our most effective tool, including with the age group that you're talking about, the 5 to 11-year-olds. The vaccine is proven to be very effective against severe disease and hospitalization. And the study that you're mentioning, its bottom line, is recommending that parents continue to get their kids vaccinated. And there's other studies that show that the vaccine is quite effective, particularly against severe disease and hospitalization. So we continue to encourage all parents to get their kids vaccinated. But if they have questions, outstanding issues, they should consult with their healthcare providers and other trusted leaders in their local communities.